name is Colette Harris. I'm the Executive Director for NAMI Prince George's County. NAMI is the nation's largest grassroots mental health organization in the United States. There are chapters in each state of the United States, plus the District of Columbia. Okay? Been in existence since 1979. So everyone in here should know and should share with others about NAMI. NAMI is here to help you and your family. How? We provide education, support, and advocacy programs on behalf of individuals who have mental health conditions and also for their families. So what does that look like? What does that look like? Well, we have the NAMI Family to Family Education Program, which is a comprehensive course to help family members understand the various illnesses and in turn learn various communication techniques. They learn about medications. They learn how to support their loved one who has the condition. A comparable course for individuals with these illnesses is the NAMI Peer-to-Peer. NAMI Peer-to-Peer is for individuals who have mental health conditions. Just like, I'm sorry I came in late, but I walked in as when the person was presenting about schizophrenia, and so forth. She was doing an excellent job in describing behaviors and how people perceive wrongly mental illness. What that all relates to is the need for education. Without education, there is no understanding. Okay? And it is incumbent upon all of us to understand mental health conditions. Why? Because of the high prevalence. 1 out of 5 adults and 1 out of 10 children is diagnosed each year with a mental health condition. Those statistics are staggering, which says there needs to be more support, just like any other illness, more understanding, just like any other illness, more compassion, just like other illnesses. When we hear of, for example, a person who has the unfortunate diagnosis of cancer, oftentimes we reach out. We reach out and we want to do our parts in helping that person get through, hopefully, the recovery process. We want the very same with mental illness. Correct? Okay? So, that is why we have May is National Mental Health Awareness Month. And I commend Lisa Gibson and her team for bringing you together and helping us, all of us, understand the importance and the need for support and awareness around mental illnesses. Okay? I'm not going to take up much more time. I want to bring to your attention that NAMI has an event scheduled next week, next Saturday. It is the largest largest event to bring about mental health awareness. It's called NAMI Walks. NAMI Walks, Maryland, will be held next Saturday from 9 to 1 at Baltimore's Inner Harbor. I encourage you to participate, to be a part of that event. It's growing. There are more people aware. I wanted to also let you know that there's more focus. I again represent Prince George's County. There's more focus in our county by our legislators about the need for better services, better quality services for individuals who need the help. Next Tuesday, NAMI Prince George's County will be presented a proclamation by the County Council in recognition of the work that you're doing on your behalf. And I'm very, very pleased, very proud of that. I also wanted to let you know that starting next month, we are launching a new NAMI Connection recovery support group in conjunction or in collaboration with Family Service Foundation. That support group for individuals, adults who have mental health conditions, who are working steadily on their recovery, will be facilitated by none other than Alicia Gibson and Alan Sweat. So please, that group will be held at Family Service Foundation in Landover Hills, Maryland on Tuesdays, the first and third Tuesdays from 6 to 7:30. There's some brochures in the back of the table there. Let's see, what else can I share with you that is exciting in Prince George's County? I just think overall it's exciting to know that more people are engaged, more people are taking part, more people are talking about mental illness. We must all remember that mental illness can strike any one of us at any time in our lives, despite our race, gender, socioeconomic status, or education. Just because you are seemingly well today, that promise is not made for tomorrow. I encourage you to be a part, take part in our activities. They are free, and please share with others the great news, the great resource that we have in Prince George's County. Thank you very much for your time.
I'm from NAMI, Montgomery County, so I won't be very repetitive here, and I think we're doing a very good job of explaining what our organization is. So I am the youth program coordinator at NAMI, and I actually started because I had my own mental health issues, and so when I was in college, I had the opportunity to do an internship with NAMI, and I started because I was just researching, and once I went through my own experience, I was like, this is happening to so many people, and I feel like no one told me about it. I didn't learn about it. So I feel like that kind of describes NAMI. It's a bunch of people who really have that experience, have family members and loved ones, and want to spread the word and provide support and education. So we have 4 staff members, and we have over 23 free programs because we have over 180 volunteers. And with NAMI programs, they're all based on lived experience. So for our support groups and our classes, they're led by, for the ones for individuals living with mental health conditions, led by a trained individual in recovery. And our family classes and support groups are led by a trained family member. We believe that that lived experience piece is so important. Yes, the medical professionals and your whole medical support team, therapists, psychiatrists are important, but having someone who's gone through it is that extra piece of hope and leads to recovery. So I'm going to leave my business card, and if you guys are interested, on our website are all of our programs. I'm kind of excited because we got a lot of emphasis on youth and the youth population, because we know that early intervention is really important. And there's that 8 to 10 year delay between onset of symptoms and treatment, and we want to cut that down. That's a long time. And we also know that about 50% of symptoms start before the age of 14, 75% before the age of 24. So we're trying to get that early intervention, and we have presentations that we do for high school and middle schools called Ending with Silence. And we bring in a young adult presenter who shares their story with the students, but also, I mean, students know the warning signs, but they don't know what to do when they're experiencing them, or even how to help a friend. So we try to go in and we try to, teach them, it's going to someone and telling a trusted adult, and just raising awareness, knowing the warning signs is important, but taking that next step and getting help for your friend. So that's one program that I'm really proud of. We also have, like Claudia said, support groups and classes. Our family to family class is phenomenal. We have a 100% of our attendees would recommend the class to other family members. We have family to family classes in the past that are still meeting monthly because they have that support that continues on. And then we've also adopted a program called Sources of Strength. Are you guys part of that program? This is in high schools, middle schools, colleges across America. They just did a huge breakout into Australia. It's in Canada. It's in like Native Alaskan tribes. But it trains a diverse group of peer leaders, which are youth, and diverse in terms of socially diverse. So in a school that could be like one from every clique, one from every lunch table, as you would say. And then you train a group of caring adults. But basically these students, or just young adults and youth in the community, spread messages of strength and hope and help and increase connections, and it's evidence-based. There's a ton of research on it. So we implemented that in now 9 schools as of yesterday. Yesterday we brought it to Gaithersburg High School in Spanish because we wanted to connect those newly arrived immigrants with the established students because there's some conflict there. So this program is just really cool and it can be used in a lot of different ways. And for NAMI we adopted it because it has that lived experience. The peers are leading. And so, I feel like I'm talking in circles. I'm sorry. I've had a really long week. Saturdays are usually my day off. But if you guys have any questions, let me know. Okay. Yes.
On the program you have, as compared to breaking the law, if you hadn't broke the law, criminal record, you had seen in court, you had a record, but you was on probation twice or something. And getting back into daily life as a mental health person, what games are available for you in that program that you have, or do you just take on regular living conditions that you might just speak to the y'all group and go to meetings or something like that? Is a program to get into?
So
to help you with something to do?
Yeah, so I mean, like our support groups are, do you mean someone who, like, do we take anyone who's
like the
committed a crime? Or?
Like the District of Columbia, is it too far for them to reach there?
Oh, no. I mean, anyone can come to our programs and our support groups. And like our presentations, we do our End in Sounds presentation. We're actually doing it at Clarksburg Jail to address the youth population there and try. I mean, everyone can come to our programs. Does that answer your question?
Yeah.
Sorry. I see another man. Yeah.
Do you have? Are they all located in Maryland, or do you have some programs in like Virginia, DC?
So that's what's awesome about NAMI. They have the national association, then we have state NAMIs, and then we have local affiliates. So we just talked with NAMI DC, there's a NAMI Montgomery County, there's a NAMI Baltimore County, a NAMI Prince George's County, a NAMI Southern Maryland. So there's all the local affiliates. They look a little different with what programs we provide, just based on how many volunteers we have, what we're able to do. NAMI Montgomery County is a pretty strong affiliate. But so NAMI National creates our programs and creates the like our manuals for our trainings and everything, and then they do advocacy at the national level for mental health supports, and then the state organizations do the trainings for our local volunteers, and then they do advocacy at the state level, and then at the local levels we run all the programs. So the local county affiliates, there's over like 200, I believe. So, and Maryland has one. Yes.
How do you find out about
I have my business card, so you can just reach out to me, but the biggest thing is you have to have that lived experience, and it's really just, you come in, fill out an application, talk to us about your story, If you're a family member and you're like, I really want to get involved and help other family members. And then we sign you up for the training through NAMI Maryland. It's usually a 3-day training, and it's due on the weekend, which is kind of a bummer, but once you're trained, then we work with you to set up like a time if you want to do the class, work with your schedule. Our classes for family to family are 12 weeks, which is kind of a long commitment. It's 12 sessions, so they meet once a week for 12 weeks. So to be a volunteer, it's kind of like that commitment of leading a class for that period of time. But for our support groups, that can be like monthly. So we work with you in terms of what you're able to do for us.
So you have to have mental health volunteers.
You either have to be an individual living in recovery or a family member. Yes. And we do get calls from, therapists all the time who are like, I really want to lead a support group. We're like, I'm so sorry. I mean, that lived experience is at the heart of NAMI, so that's unfortunately we have to say this. Okay, thank you guys.
Hello, everyone.
Hello.
My name is John Ward. I'm the director of the Mobile Crisis Team.
She has some questions.
What's your question?
Go ahead, keep going.
Oh, go ahead. So I got questions before I start. So director of Mobile Crisis for Department of Behavioral Health is in D.C. I'm actually located out of CPEP, the Comprehensive Psychiatric Mercy Program, located at D.C. General. They actually have programs at CPEP. A lot of times people say CPEP, especially when DC came to my house, CPEP was here. It's like, actually we have a psychiatric emergency program, and that's 24/7. So anytime we have an individual, so I know in Maryland it's a little different. You all use emergency petitions, where at DC we use the FD-12. For the most part, the same kind of concept. And so people who are on the FD-12, they're able to be brought to CPEP, and they're evaluated. The average stay of an individual on CPEP is like between 19 to 20 hours. Also, voluntary individuals in crisis or who want a psychiatric evaluation are welcome to come to CPEP. The other program at CPEP is one I'm in charge of, the Mobile Crisis Team. The Mobile Crisis Team works 7 days a week, 16 hours a day. And so that's from 9 a.m. to 1 a.m. We have a team of like social workers, mental health counselors, mental health specialists to go out and assess individuals that are deemed in crisis. We see referrals from citizens, family members, neighbors, mayor's office, and also what's called our community-based mental health programs, of course, certain agencies. So we go out and support them to be able to assess and assist individuals who are in a psychiatric crisis. I always want to put out psychiatric crisis. A lot of times people feel any kind of crisis, they really want to call us. We're directors, that's what we actually cover. Sometimes actually the individual who was calling was more crisis than the person that called him about. And so we have to sometimes provide a lot of support to them. Yeah, because as you know, with many of the challenges and stigma goes on mental illness, the fact that people see anyone who's mentally ill and sometimes they feel in a state of crisis, you all need to come out, you need to intervene. And you have those situations. I always say people are suffering in silence, family members working with their loved ones, they've tried their best to the best of their ability, and they're seeking help, or sometimes they're within, they just want the person removed. Or the neighbors, they want to remove. They're like, hey, I don't care what you all do, come here and remove that person. And that's the bottom line. If we don't remove them, then they feel we haven't done a really good job. But in essence, we provide education, help them to understand, to support, to provide access resources for their loved ones to be able to understand some of the symptoms and how you can support, how you can be effective in maintaining a person in the community. And we find it to be very effective because sometimes a lot of people, they just don't know. Right? They don't have too many times like folks are coming to their home to provide education, to provide knowledge, actually assist them with linkage. We provide psychoeducation. And we also work with individuals that experience a traumatic event. So we have a lot of shootings, we have a lot of deaths. So my team will provide grief and loss counseling, and if need be, we'll refer them for like we have the Wentz Center for ongoing grief and loss counseling. provide a lot of support during disaster behavioral health. So anytime you have a disaster in DC, my team will go out and respond. During like the cold emergencies, I don't know if you all have the same here in Maryland, but once the temperature drops below 20 degrees with precipitation or 15 degrees, then DC declares a state of emergency and everyone is housed. My team is tasked with going out to assess individuals to see if it's safe for them to remain on the streets. Okay, a lot of homeless individuals, a lot of people who have access resources, a lot of people are stranded. We have a lot of tourists that come into town, so we go out to assess. We proactively bring them to like warming centers, to the shelters to make sure that right now they're safe. I'm always proud, glad to say that no one, as far as passing, cold emergencies. So I always tell my team to do one good job in the district as well, providing those resources for folks who are without. So very important. And the third program is the homeless outreach program. We have some of the similar components to Global Crisis in that they're able to respond to crisis, emergencies, but they focus on homeless individuals. They go to the streets, bridges, abandoned buildings, alleys, wherever a homeless individual is located, they will go to assess, to engage, to offer services to support them. Right now, we're at a very interesting time in the district where the mayor has allocated a substantial amount of resources, basically, to like homeless services, which is always a good thing. And homelessness chronic homelessness in the district, or at least decrease homelessness in the district, which is always an awesome thing. So right now, the team is working with different providers like DHS and other homeless outreach programs to be able to get folks linked up to services. I don't know if you all have the vulnerability index, service prioritization, decision assisted tool. Yes, for that. But pretty much something, it's a unified survey tool that we're using to be able to identify the different level of housing a person may require. We're looking at maybe like refugee housing, or permanent support housing, depending on their score, and we utilize that as a means of being objectively providing service for individuals compared to before, where people were going to like different programs saying they had need, or we didn't really capture the most vulnerable individuals. Because the fiasco that was born out of the high mortality that we're seeing within the homeless population. And so now being able to have a unified tool that will be identifying the most vulnerable and get connected with housing and other resources. So also, I know I'm supposed to represent the Department of Behavioral Health. One of the major numbers, and nothing else you take away from our presentation, is our access helpline. So no matter where you are, especially in the district, you call this number 24/7. We've got suicide hotline as well. But if you want to access any of the Department of Behavioral Health Services, and that's 1-888-793-4357. It's basically 1-888-WE-HELP. With that said, any questions?
I have a few questions.
I see right in the front. You know what? I'll sit back and see if I can ask some of these questions.
One of the biggest challenges that loved ones face is what to do in an emergency. What advice or suggestion would you give?
You call that 1-8 number because you get well in the district. Let's make sure our frame is appropriate because I don't know the resources in Maryland and I don't want to misrepresent those services. So in the district, you'll call that 1-8 number so they be able to present their case. They talk to someone. These are some of the challenges. These are some of the concerns I have. What are some of the available resources? Because you have the different community-based mental health programs located throughout the district. So if you need be, they go to a local community-based mental health program to get that person linked to services.
Okay.
And also being able to help talk out what are some of the concerns. Because some of it is just like the person may be symptomatic, being understanding, may educate that caller about, hey, this is the part of this person's life, this is a part of your life as well, especially with your loved one, and there's other support groups and supports for you as well.
The second question that I have for you is, what should a family member do if they ask for help and their loved one was not deemed to need it? Should they call the police and they call the police and nothing happens?
Well, right now that we're training more officers to be more understanding and have more knowledge of like mental illness. Because just calling the police doesn't resolve the issue. It is not adequate solution, right? It's just like the beginning. Because you want to ask for, especially in DC, a crisis intervention officer. So at least those individuals have been trained by the Department of Behavioral Health, so they're aware of services, and if nothing else, if outside their scope or their knowledge, they can call someone to come in, typically make a referral, say, hey, we have an individual here, they have mental health concern, is your team able to come out, support that person, get them linked? We'll actually provide transportation to their first appointment, because we want to increase some of the barriers and challenges to mental health. Also to be able to talk and educate people about, like, hey, like this is their support, their ability where individuals can actually function. So we actually have peer specialists on my team, so be able to talk to people from that lived experience of what's going on.
When should help be called?
Help you call whenever you think you need it, right? Whenever you think you need it. We don't, like I said, we don't want to wait till you in a situation where you're at your wit's end and you're ready for that person to be removed, because at that point, you're no longer really receptive. You know, sometimes when you look at like best prognosis for anyone, the more supports that person has. Right? So while that person is a very strong support system, and they may not know how to be an effective support system, and then we don't want them to be at a point right now they're fed up, they're exhausted. We'd much rather have them at the beginning, where we'll be able to help them understand what is their role and how to play an effective role in supporting their loved one with that approach.
That's all the questions I have.
And more, I guess, like, anyone else?
Would you give us your name again?
Jonathan Ward.
Ward. Okay. And is there a number of your office?
Yes, 202-673-9302.
You all do deal with housing
In the sense that we have, in CPAP right now, we're training our social workers to be able to administer the VIs for that, as folks who come in. And we have our Homeless Outreach Program. They're already trained to complete the VIs for that. And so that is something where that number, the scores go on to like DHS, which if I identify the person who scores high, who needs like housing, so through that means. And also through the Department of Behavioral Health, they have a housing department where individuals obviously are in our system are able to access housing as well. So but not us. Correct.
You got options for housing? You got a limitation for housing?
So it's like a limitation in regards like volume, in regards to actually or like restriction or because in regards to housing, you know, unlike what we call like the Department of Housing, where you come in, you assess, like you show your need for but the Department of Behavioral Health is always associated with like a mental health component.
Do you have an emergency housing?
Emergency housing? The only emergency housing in the district are the shelters. Yeah, and I don't know if that's the best option. I know a lot of times, I don't know if you all have been in a shelter, that's not anything to go on, but sometimes it's not safe and a clean place for some people, and so sometimes they're not an option. So
They still.
yeah, it's still a rough, you know, and to know people who've been there and actually been there myself to see some of the challenges. I don't always just say, hey, recommend housing or let me recommend a shelter, because a lot of people say, there's shelters available. But you know, go there, see that, see if you're comfortable. I know, yeah. And you know, always they have like say, they would counsel person, someone else to go, but like, yeah, they're prepared for the individual. So we want to make sure that should be the experience for everyone every day. Yeah, and that's it.
There's one thing, and I'm like thinking about like the questions we asked in our programs in high schools. So if someone was, you know, talking about suicide, but they were underage and it was like they were at a party and they were drinking and doing drugs, and we called the local crisis team to come in, would there be any consequences for that? Because that's like a barrier too, that they're scared that they'll be in trouble.
But because definitely more progressive, right? We learn and understand just because a person like avoids suicide, a nation don't necessarily, hey, they need to be hospitalized, they need to be behind a lot more. But my team would go out, you know, daily, weekly, monthly to actually engage and assess individuals who actually avoid suicide ideation and still leave them in self-care and support them in accessing resources, support them in being able to remain at home in the community if it's within reason. Because you know, obviously when people have plans with suicide, then that's a different animal. But for those individuals who may be living with like suicidal thoughts, and but still able to maintain it, and they're very forward thinking, they have a lot of support system, they're able to like access the mental health services on their own. We work with them and making sure that they have support. They know what they're doing, they have to call us and come out to support, call us, and I would make sure they get like to their appointments, especially the first one as well. And then with also kids, we have a children and adolescent version of Mobile Crisis. So they work with the schools and with kids, they go out there and assess them, and they help educate the parents. And a lot of times, you know, we say about the stigma, about work by the help, but then also the work by the parents. You know, and so, and I know that that is always something that is a challenge, because we have to have the parents know that we have to be receptive. Right? We want to make sure the kids feel comfortable in sharing their thoughts, sharing their feelings. Might not be, you know, what comes out of involvement, be something you want to hear, but at the same time, they're sharing with you. Right?
Suicide. I know you have signs, but can some suicide attempts be more or less final?
That's a person hit, like hit a sister or brother, they kind of find out maybe that person attacked them first and there's a response, but we were making sure it's a part of their mental illness.
So what is the process of getting one? Does, for example, if the MPD officer is the one like coming, you know, being called, etc., to fill out the form, etc., like does he have to see like some kind of an evaluation, kind of, you know, outlining that the person has mental illness diagnosis or what?
So typically MPD, you know, call 911, then they'll provide. I mean, for a PUN program, we'll call and we'll ask you a few questions. We'll ask you like, what is some of the behavior, what are you seeing, and being able to see that the presenting problem. And it's based on acute disturbances of either mood, thought, behavior, or social action. Acute, right, and very recent. That's something that happened last year, like something happened like at the beginning of the year, but very acute. So much people ask you questions, find out what's going on, and try to get at least an idea, preliminary idea that there's obviously some likely to injure due to like some mental illness, and then they'll definitely respond. Now, granted, there's sometimes where it may not be clear because a layperson calling does not know about mental illness, might not know about behavior. So if they say some risky behavior that person is displaying, then we definitely want to come out and check, evaluate, go see what they eyes in the person. Because sometimes they just need to the person get linked to our services. Before we move deploy, we may find that if that person is in our system or the proper behavior health, and we want to involve in case management. Because case manager may be unaware of certain behavior, or they are aware of this behavior and they can help inform our team. I don't know, did that answer your question sufficiently? Okay, yes.
So I know for Montgomery County has like the mobile crisis team also, and through the Montgomery County Crisis Center, and you guys know that. But they, for when they come out and for a mental health issue, they bring like a psychiatrist and they do an evaluation on the site with the police officer. So it's not just like the police officer. Is that the same?
Because MPD can call, because you call them one. They'll go out to my team, because we have a clinician, so they'll come out and conduct an assessment, yes.
Right.
Yeah.
So if you call 911, you can ask for a CIT trained officer.
Yeah.
But if you need like the on-site evaluation, you call the mobile crisis team.
Right. There's different. Yes, sir.
There's such thing as emergency abortion house.
Say again, I'm sorry.
Abortion. Like you got abortion.
Voucher, emergency voucher program.
Voucher.
Voucher, I'm sorry. So, sometimes like vouchers are typically attached with that services, right? You know, you connect with a program.
Ain't no emergency.
Not emergency vouchers, is there examples in Maryland, we have to have emergency vouchers, so I better understand that, because typically, like I said, we have like the shelters for people who have like, if they're part of our mental health system, then they're able to get like housing through like those respected agencies, like housing department. We got folks who come in out of St. Elizabeth, where they work with them, we have like linked to vouchers. Right now, we have to be asked for that, we're using that assessment tool to be able to identify people who are the most vulnerable, for like the people linked in with vouchers. We know we have like individuals who do domestic violence, they go to a program where they may need relocation, so we have, you know, that program available in the district. But in regards to like, if somebody with an emergency receives a voucher, typically you already have to be assigned a voucher to whatever program entity, and then now they may want to do a transfer. Yes.
They have some crisis houses in the district, like Murray Care House.
Yes, so we have the like sums, we also have like crisis bed, you know, obviously the person can go in and so transfer from like respite, so yes, we have some resources with it. I know it's kind of hard, especially I'm holding that lunch right now. All right, thank you all.